Here are the top 3 reasons why age is not a cause of hip arthritis. I decided to create this video because I've had so many patients over the years who have hopelessly told me that there's nothing that can be done for their hip arthritis because it's due to their age. And when I ask them what makes them think that it's because of their age, they tell me that that's what a doctor told them when they were diagnosed with the hip arthritis. They'll say that the doctor told them that hip arthritis is an age-related condition that just gets worse over time. And it's just a matter of time before it gets so bad that a hip joint replacement is needed. But let's challenge this thinking. I have a few questions, these reasons that I want to ask you and get you to think about this. The first one is, what about the other hip? Now, most people have one side affected, and there are cases where there's both sides that are affected, but in most cases, I see patients that have just one hip affected with hip arthritis. In those cases, what about the other hip? Because both hips are the same age. If hip arthritis is truly an age-related condition, then it would make sense that once this person hits a certain age, 65, 75, whatever it is, those hips are that age, and if one gets hip arthritis, one side gets hip arthritis, but the other side is actually okay, then that doesn't make sense to me. Why don't both sides get it at the same time consistently? And people will say things like, well, I fell on this hip a long time ago, and ever since then it's never been the same, and so that's why I got hip arthritis. But I also hear people say this, well, I fell on this hip a long time ago, and I'm not sure why that one isn't the one that developed hip arthritis. You would expect that one to have developed the hip arthritis because I heard it pretty bad. I even had a car accident afterwards, but it's the other side that had hip arthritis. And I've never had a problem with that one until now. The fallacy here, or the incorrect line of thinking that we have as a healthcare profession, is that we align age as being a reason for hip arthritis. We've connected the two, or we've correlated them. That's the term that they use in the science, is there's a correlation between age and development of hip arthritis. And so as a result of that, they'll blame hip arthritis as the cause of hip arthritis, when in reality, a correlation is not a cause. It's just something that you see happen together. The better way to think of it, so that you're not falling into that fallacy, is that there's a problem, there's a root problem causing hip arthritis. And if that problem is there over time, it's going to get worse. It just so happens that over time, we also age. And so we think that age is the reason for the hip arthritis. It's like saying weeds grow in a garden over time. And there's nothing that can be done about the weeds, they're just going to ruin the garden. But we all know that if you go pluck out those weeds, you'll get rid of them, and your garden can be healthy. It's a similar thing here. If you can fix the root problem of hip arthritis, you can have a healthy hip, no matter your age. Number 2 is, why doesn't everyone get hip arthritis? So most people tend to get hip arthritis in their 60s and 70s. But I have met many people that have come into my office for other things not related to hip arthritis, and they're in their 80s or 90s, and I have to ask them, how are your hips? And they say, fantastic, never had a problem in them. Now here's what I think is happening with this. There's something called the Bader-Meinhof phenomenon. And what this is they call it a frequency illusion. Or in other words, when you see something and you become aware of it, then you begin to see it in other places. A common thing that happens is, like, you get a brand new pair of shoes, and you had never seen those shoes before until you went and got those shoes, and then you start noticing other people that have the same shoes. It's not that everybody got the shoes at the same time, it's that you were never aware of them, so you were never really looking for them. And a similar thing happens with hip arthritis. When you hit that age and you start getting hip problems, then you start to become aware that, oh, people that are 70 get hip arthritis. Like that's a thing that happens sometimes. Then you start finding other people in your life that maybe you know, or maybe that you hear of on the news, that also had hip arthritis. Maybe that person at church that you knew and who never told you anything all of a sudden reveals to you, oh, I have hip arthritis too. And you start to realize all these other people that have hip arthritis or have had a hip replacement. This even gets extended to healthcare professionals because they're seeing people that have hip arthritis and they're making these same connections, these correlations, and saying, well, everybody in their 70s eventually gets hip arthritis and then they eventually get a hip joint replacement. But that's the fallacy. When you think about the shoes example, not everyone has your shoes. I got it recently when I got a car. I got a different car, and I started realizing this car is everywhere on the road, but it didn't just happen. That car's been around for a long time. It's just that I started to see it more often. The better way to think of this is that not everyone in their 60s and 70s is going to get hip arthritis. It's not an age-related problem. It's just that you start to notice the people that are getting hip arthritis tend to be in their 60s and 70s. But there's some that are younger, there's some that are older, and there's some that never get hip arthritis. Just like there's people that never have your shoes, and there's some that do have your shoes. But if that's the case, then it means that it is possible for you to never have hip arthritis, or to have hip arthritis like you might right now, and then for it to go away. Which leads me to my third reason. The belief that people don't think that hip arthritis can go away once you have it because of your age. But I have to ask the question, because I see this happen all the time. Why do some people get better in their hip arthritis despite getting older? Now, many people in healthcare, doctors, surgeons, physical therapists, nurses, everybody that works in healthcare that deals with people that have hip arthritis problems, consistently see people worsen as the years go on, as the months go on, and eventually get a hip joint replacement surgery, and then even still after that have hip problems. So they're connecting the two. They're thinking, well, as you age, you just get worse and worse, and the hip arthritis, there's nothing you can do to reverse it. But I can tell you, I've seen so many patients here in my clinic literally not have hip arthritis symptoms afterwards. Now, they'll go through our treatment approach. They'll start to offload the joint. They'll start to calm down the pain. Then they'll start to fix the root problem so that the muscle imbalance is normalized around the hip joint and they can move it well. And they'll get back to being normal again. I mean, to the point where they go back to exercising, walking as long as they want, being on their feet as long as they want. It's as if their hip never really had a problem to begin with. And some of these people have been told that they have bone-on-bone hip arthritis, and some have even been on the schedule to have a hip joint replacement done. They're so glad they didn't have it done. But now, I'm telling you this is possible, and there isn't really like a different way to think about this. What you've got to do is discover this for yourself. You've got to go try out our treatment approach and figure out if this is going to work for you or not. It often does for all our patients here. It usually almost always does. And patients are skipping having a hip joint replacement despite time passing and them aging and turning another year older. They actually get to feeling younger because their hip is healthier. I think if anything here, it's not as much a fallacy as it is a false belief. We have a false belief that hip arthritis just doesn't get better, especially as you age. But if you can put that false belief aside and try to do something that will fix the root of the problem, then you might be able to overcome that false belief and get some amazing results that are going to improve your life for the better, for the long term. If you want more information on how to fix the root problem on our treatment approach, then I want to invite you to go check out down in the description our hip arthritis recovery program. Now, this program is over 30 videos that take you step by step through our treatment approach on how to address the root problem of hip osteoarthritis, even if you've had a bone-on-bone hip arthritis diagnosis, so that you can decompress the joint and allow that cartilage to heal for the long term. And I've also got a bunch of other videos on YouTube here that talk about the treatment approach and different things you can do, tips, advice, exercises. You'll find those all in a playlist called the Hip Arthritis Help Playlist. Both of those things, the hip arthritis program and the hip arthritis playlist, are linked in the description below. So just open up the description and you'll be able to see it there. Hey, if this video was helpful for you, please give us a thumbs up. Don't forget to share this video with somebody you think needs to see this. And please subscribe to our channel and hit the notification bell so that you don't miss out on any of the helpful videos that we post each and every week. And don't forget to drop a comment and let us know what you think of this video. Thanks so much for watching. I'll see you in the next video. Bye-bye.